Welcome back. Over the last couple of deep dives, we started a really necessary process,
Mm,
testing those big public claims that this system is unique, a world leader, that others are learning from it.
right. And we treated them as claims, not facts.
Exactly. We went hunting for proof inside the official report itself.
And we found those high-level claims weren't, let's say, directly supported in the source's own language, but that analysis is incomplete.
Incomplete until you get to the recommendations.
Exactly. The ultimate source of truth in any review is always the recommendations.
Okay, let's unpack this. Everyone points to these 29 recommendations as the roadmap, but for us, they're the real stress test. What do they actually tell us about the system's health?
That's the mission today. Recommendations are crucial because they're a perfect mirror of what's missing or failing. They usually reveal one of two things.
Okay.
Either they detail exportable strengths, what the system does so well that others should copy it, which proves leadership, or they reveal an internal rebuilding agenda, a list of what's missing, what's weak, and what needs urgent fixing. And that simple test is exactly what we're applying here.
So we're treating them not as a suggestion list, but as hard evidence that has to either confirm or, well, deny the system's status?
It's all about verifiable wording.
Mm-hmm.
And demanding that kind of clarity, that kind of accountability, it already signals urgency. The source itself says things need to move fast.
And this quote really sets our tone for this whole deep dive, doesn't it? It emphasizes that need for action.
Tells everyone that important changes need to happen fast.
So to respect your time, we've done the work of summarizing all 29 recommendations into logical, clean blocks. We're not going to read the whole report.
Right. This is about structure over clutter.
We want to map the system's needs clearly.
And we found we could group them into 8 distinct thematic blocks. Think of this as the definitive map of where the system needs attention.
So what's on that map? What are these 8 blocks?
Okay, starting with the big picture and then moving inward. First is governance, standards, and public accountability.
Makes sense.
Second, risk-based oversight and quality outcomes.
All right.
This one is obviously crucial for safety.
Right.
3 is planning and roles, with a focus on being person-centered. 4, coordination, workforce, and system competencies.
Okay.
5 is a basic mandatory plan package for every single home share. 6 is data, turnover transparency, and a provider registry.
Data transparency, that's a big one.
Huge. 7 is housing, crisis options, and connection to healthcare. And finally, number 8 is funding.
Okay, block 8 funding, that one jumps out immediately.
Yeah.
If we're talking about an overhaul, money is usually at the center of it.
It is.
Yeah.
It belongs in the map, but we have to recognize a huge constraint that was placed on the review team.
By who?
By the ministry. They limited the scope. Here's the quote. MSDPR told a review team that the amount of money paid to home share providers is not part of the review.
Wait, hold on. The ministry asks for a total system review, but explicitly excludes provider pay, arguably the most talked about part of the system.
That's right.
Doesn't that immediately weaken the whole report?
It absolutely constrains the finding.
Yeah.
Because pay was excluded, and because the report doesn't give us a detailed funding allocation, we have to be really careful.
What can't we say?
We cannot responsibly conclude, based on this source alone, that the entire system is underfunded overall.
Mm-hmm.
We just don't have the evidence for that specific claim in this document.
But okay, we stick to the evidence. We know the limit.
Correct. Now, while those 8 blocks give us the technical map, we can actually condense them even further.
Into what?
Into 5 core actionable directions for change. This is the structural guide you should really carry forward.
Okay, what are those 5 big directions?
So if you connect the dots, they are, first, governance and accountability. So verifiable standards, stronger provincial leadership, transparent reporting.
Right.
Second, safety and risk. This means risk-differentiated oversight, a quality-of-life tool, and regular public outcomes reporting.
Okay.
Third is planning and coordination, sharply strengthening person-centered planning, clarifying roles between the agencies, and reviewing accreditation.
And the 4th?
People, training, and data. So publishing real data on turnover, a basic accountability measure, a provider registry, a standardized planning template, and, addressing sustainability and provider pay.
And the last one?
Expand the support system. This is about closing the gaps. A housing strategy, real crisis options, clarifying boundaries with health and mental health services, and this is critical, strengthening follow-through on coroner findings.
That is a comprehensive map. Let's zoom out a bit and just look at the sheer volume of fixes here. This is where we do our signature rapid readout. This is your immediate to-do list.
Right. And listen for how foundational all of this is.
Strengthen expertise.
Implement standards.
Transparent monitoring tools.
Risk-differentiated oversight.
Sharply strengthen person-centered planning. Clarify bureaucratic roles.
Publish real data and turnover rates.
Maintain registries and mandatory plans.
Address sustainability and provider pay levels.
Build housing strategy and guaranteed crisis options.
Strengthen follow-through connected to coroner findings.
Wow, that sounds like a complete reconstruction. It's foundational stuff, not cosmetic tweaks.
It is. This rapid sequence confirms our key inference. If these are the recommendations, it means many of these foundational elements are just missing or inconsistent or not strong enough.
They require urgent strengthening.
Right. Urgent structural strengthening.
And this brings us right back to our mission. If the system were a world leader or had unique technologies, what would this list look like?
It would look like an export package. It would be focused on optimizing an already great system, documenting best practices, telling others how to copy them.
But that's not what we found.
No, we found the opposite. The recommendations do not read like an export package. They read like the punch list for a contractor called in to fix a leaky foundation.
So the claims of world leadership just aren't demonstrated by this list of necessary actions.
Not at all. This is clearly an internal rebuilding agenda.
Okay, let's pivot back to the constraints. We talked about the financial scope limit, but there was another one about public input. How much of the public's voice was actually captured here?
The process was indirect and limited. The investigators didn't get public input directly.
And the quote that defines this is really important for you, the listener, to understand.
Public submissions via the ministry email line, approximated 20, were received by the ministry and forwarded on a basis as appropriate to the review team.
20 submissions. That's a pretty clear constraint on how much direct public experience the team could process.
It is. It limits the certainty we can have about system-wide public perception. We're relying mostly on the team's internal professional analysis here.
So, accountability time. The contract is done. The public paid nearly $75,000 for this, and the roadmap is delivered. The question now is, what's the right tempo for action?
Accountability has to start with the timeline the report itself sets out. We have a hard frame dating back 7 years.
Let's review that, because this is where the speed of change becomes, well, alarming.
Quote 1, in January 2025, a coroner's inquest was held into the death of Florence Girard at the time of her death in 2018.
So the incident was in 2018. The official response, the inquest, happened 7 years later.
And quote 2 emphasizes that long gap. Several changes have been made to home share since Florence Girard's death. A review is needed to evaluate whether CLBC's changes since 2018 have improved safety.
So the report was checking on 7 years of reactive changes.
And now, quote 3, which details the actual response to the coroner's findings.
What was it?
Additionally, CLBC launched a pilot program in 2025 in which quality analysts conduct direct visits with home-sharing providers.
A pilot program.
A pilot program, 7 years after the incident, that demanded immediate fixes. The pace of change seems incredibly slow.
So why the stall? A 7-year gap between a tragedy and a pilot program suggests a serious internal brake on progress. What does the report suggest that brake is?
That's the critical first step for implementation. You have to identify and remove that brake. If progress moved that slowly, it suggests the internal culture or the resources or the political will just wasn't there.
And if you don't remove that resistance, the new plan just stalls again.
Exactly. So first, diagnose the stall.
And second, what about actually implementing these 29 points?
Second, the plan has to be fast and measurable. Implementation needs to be measured in months and maybe 1 to 2 years, not just someday. We need deadlines, public reporting.
Why the emphasis on speed?
Otherwise, it just becomes what we call kicking the can down the road. You're just postponing difficult or costly decisions while nothing actually changes for the people who rely on this system.
But planning 29 complex changes across governance, data, housing, that sounds like it would be hard to do quickly.
It is, but the report anticipated that. It already provides prioritization. There's a detailed Gantt chart on page 52.
A Gantt chart?
Yes. It suggests which initiatives to tackle in which quarters. The path for fast, measured decisions is already wide open. The political will just needs to exist.
So the technical difficulty of phasing is already mapped out. It just needs execution.
Precisely.
Before we wrap, let's circle back to that finance limit one last time. If a full funding audit wasn't done, does that stop them from implementing the other 28 recommendations?
No, not at all. The core system issues were mapped. The ministry likely already has the internal financial details it needs, especially since they were the ones who limited the scope in the first place. The road to implementing the governance, data, and safety changes is clear.
So for you, the learner, your task going forward is pretty simple. Keep checking public promises against the facts and the timelines, the dates, the deliverables, the accountability. That's how you stay informed.
And maybe a final distinction to leave you with, to really test those claims of leadership and uniqueness that requires a long-term comparison with previous reports over a decade. That's one investigation.
And the other, more urgent investigation.
That's answering why change stalled for 7 years. That requires immediate accountability. Who delayed what, when, why, and demanding this 29-point plan gets implemented in months, not decades.
Agreed. The focus has to shift entirely from slogans to measurable responsibility, to concrete dates.
Until the next deep dive.